ORCA actually stands for the Organisation for the Review of Care and Health Apps. Our mission is to improve lives through digital health. The reason we have the name that we have is because if you're going to do that, you first of all really need to understand which technology is safe and quality, and know which technology will have what impact for which communities of people. And so we're completely obsessed with reviewing and assessing technologies on an ongoing basis to learn more about the technology and then get the great technology to people who need it.
And you, by training, are a clinician specializing in speech therapy, is that right?
That's right, yeah. So this is quite a long time ago now, nearly 25 years ago, and I worked as a clinician up until about 10 years ago. So I trained as a speech and language therapist and developed my specialism in complex paediatric care. And it was really my passion of wanting to help people that took me into a clinical world. But what happened for me on day one working as a clinician was a real frustration that I could only support one patient at a time. And it sounds so basic, but I just thought, how can I possibly help more people have access to more healthcare? And at the time, and it still continues to be the case, you know, the waiting lists were significant. But this was, of course, before technology. So I got obsessed with how do we strip out waste? How do we release more time to care? So I got really interested in lean methodologies. So that as a clinician, I could do more of seeing patients, and maybe other elements and tasks could be handed off to somebody else. And that was really transformational, you know, rather than seeing 6 patients a day, I was able to see 10 or 12 patients a day. What happened was you fast forward a few years and you see that everybody's bought the infrastructure, which is smartphones. And so an interesting fact that I quite often quote is there are now more smartphones on the planet than there are toilets or toothbrushes, because a lot of people have more than one. And then what we also saw was the rise of digital health technologies, so software, health apps, web-based solutions, etc. And I thought if we can deploy the best technologies to people who have smartphone devices so they can access that healthcare when they want it, but that it's personalized and targeted, then we've got to be having an impact. And then you coincide that with the fact that every day 5 million people will download a health app, but only 20% of what's downloaded is good or quality. And so what that means is the majority of people are not downloading safe technologies. That means that there could be unintended consequences for the use of using poor, unsafe technologies. But we also have a missed opportunity. If we can just get great technologies to the people who want it, we're going to have an impact. So that's been the driving passion behind ORCA.
And what have you managed to do so far? What sort of areas have you investigated and made recommendations in?
We've seen a massive growth in mental health condition support tools. And any clinical condition that you can think of, there are lots and lots of technologies. And so what we've been doing is assessing technologies. As I said before, that's an ongoing assessment. Every time the technology updates and changes, we will reassess the bit that's changed. We've assessed just over 20,000 technologies now, and we add about 500 new technologies to that repository every month. And then what we do is work with our partners, who in this country are the NHS and local authorities, to say, what's the problem that you're trying to support? And they may say, you know, we have a real challenge in mental health waiting lists, or we have a real challenge in elective recovery, or we have a real challenge in X, Y, Z, etc., prevention of type 2 diabetes. And what we then do is we then are able to create bespoke digital health formularies in the same way that we have drug formularies, and then we provide training for the healthcare professionals so that they can use that formulary, know which technologies are safe, and then recommend it via text message No, the text message piece seems really not that important, but the reason it's important is because as we deploy these technologies to our communities and patients, we need a way to monitor the ongoing compliance and quality. And should we need to do a recall if there's a data security breach, or if there's an update to that software that then creates a now unsafe platform. So we've worked in most clinical areas. There are some top areas which come up repeatedly. Mental health has significantly been an area of interest, not just here in this country, but internationally as well. So we work in 12 countries, and mental health is a big area.
Aren't a lot of the apps in that area kind of a bit, vague, or there's a real spectrum, isn't there? There's an awful lot of mindfulness apps which may be fine, but is listening to whale song really going to help me sleep, for example?
So if you want to stay mentally well, you may find that listening to meditation and meditating is helpful. But obviously, if you've got a low-level mental health condition like anxiety, stress, or depression, you might want to use an intervention there. Now, we have done some detailed research in the mental health space, which I'm happy to share the report on. And on an aggregated view, 38% of all digital health technologies in mental health are quality. But then when you start to drill into the details, so once you get further up into the more severe end of mental health, say schizophrenia, OCD, etc., you're talking about 5% of the technologies available are good and quality. So the reason for that is because obviously the risk associated with something like a whale song technology is far less than, say, a suicide prevention technology. There is a breadth to digital health technology in the same way that there is for drugs. So taking a vitamin versus over-the-counter drug versus a prescribable drug versus a controlled drug is different. So to your point, a low-risk, low-impact technology might be for somebody who wants to stay mentally well. But if I'm feeling depressed or anxious, I'm going to need something a little bit more refined, and it might be best to get that from my GP rather than me just independently trying to search and find something.
Now, another example, I think you did a recent study on period trackers.
Yes, we did.
Quite in the news lately. Why did you do that, and what did you find?
Yeah, so I mean, this was spurred by two things. One, obviously, we've all seen what's happened in America around the laws of abortion. And so what we've seen as a consequence is more women turning to period trackers to monitor their fertility in an attempt to try and maybe not get pregnant. So and actually, period trackers are already the highest downloaded digital health technologies globally. So it's already a massive used area. We also saw a big legal case because one of these period trackers was sharing data and selling data from the period tracker. Now, what that meant was there was a big pushback to say everybody needs to stop using period trackers. And what we're saying is actually that's too extreme. What we need to do is be clear about which period trackers are safe and data secure, clinically valid, and let's just get those technologies out. So we did a big piece of research where we assessed all the technologies and we're highlighting which ones are the best technologies.
A lot of them were not great, is that fair?
Yeah, oh yeah, the majority of them are not good. And that's the thing in this world of digital health. It's like trying to find a needle in a haystack. And that is just from a quality perspective. The next question is, well, which one will work best for me and my personal preferences? And this is really important when we're talking about technology, because I, for example, use Apple devices. Somebody else might use Android. Somebody else might want to use a web-based platform. But equally, I might have different preferences. So I might have a visual impairment, which means I need something different from my technology. Somebody else might have a hearing impairment. Somebody else might have a cognitive impairment. And you start to, the cost also plays a role. So we have to not just find the high quality technologies, but then also find the best technology that meet my personal preferences and needs.
There's been so much hype around smartphone apps and health, but what you're saying, I can imagine some people and some doctors actually saying, actually, should we be a lot more cautious about getting involved at all? Because an awful lot of them are flaky. They may cause more harm than good.
The reality is people are already using these technologies. And so what's happening in clinic is patients are walking in saying, I'm using that health app. That's quite scary if you're a clinician, because you've not been trained in this space. And so, of course, your natural position would be don't use anything. But what I'm saying is there are good technologies out there. We can tell you which ones are good. And if we can encourage people to use those good technologies, then we can have a positive impact. And this is particularly relevant when we're talking about people waiting, say, for example, for mental health support. What we know from national data is that somebody's mental health will get worse while they wait for an intervention. And we've done studies to show that if a person is recommended a safe technology that has a positive impact, they won't necessarily improve, but they will maintain their GAD score, is the score that you use clinically. So that when at least they come into clinic, they've not got worse, and also hopefully not had a crisis around self-harm or suicide during that waiting period. So I think I completely understand the nervousness, and this is why I'm obsessed with workforce development and training, because we're asking medics and clinicians to recommend technology or prescribe technology without the relevant training. And if we're not trained in stuff, we won't deploy it, because we need to feel comfortable. You know, we have a duty of care to our patients. And that's why I'm completely obsessed with workforce development.